Okay, time for a video. So, what I thought I would do, because we've got quite a large number of letters for this week, and there's no way that I will have time to do 40 letters this week. Well, no, I could maybe do them all in a week, but everybody will be sending me letters every day, so that's no good. So what I'm going to do instead, I'm going to make a video of various letters, and we'll see how it goes. So let me take a look at this one. So I have a letter. We'll take a look at that in a second. First things first, let's look at the task. I've seen this before. It's about a couple who are failing to conceive. Okay, so first thing, go to the task, letter of referral. Okay, ask the specialist, well, refer for specialist advice. You've all seen this one, I'm sure. So we've got a history. Let's have a look. She's got one child already. Unremarkable medical history, no medications, tired, so lots of stress, difficulty in sleeping due to work stress, anxiety, and this could well be affecting the inability to conceive. Well, let's take a look. So, first things first, let's have a look at the word count. So what I did, I just copied the body. 217, okay, that's not bad at all. Okay, aged 38 years. Well, you don't need to put that, or just say age, put it in brackets, maybe, just put age 38, doesn't matter. Okay, marketing manager with a single child who is a patient in my general practice. She needs your further advice and management regarding her sub-fertility issues. Okay, well that's pretty good. So I don't really need to know, well, I don't think we really need to know, her occupation right from the start, unless it's pertinent to her being unable to conceive, but still. As a patient in practice, she needs your further advice and management. Well, management advice. Now, you want to avoid using the same expressions that everybody else uses. But this one's better because it does say sub-fertility issues, so that's good. Okay, so what's the main issue here? Presenter complaining of tiredness, lethargy, insomnia. Fully assessed and diagnosed with stress-related anxiety and managed accordingly. Okay, well the grammar's good. Lots of passive. Okay. I don't know if I would have put this first. I don't know if I would have put this first. And in the notes, I think it says, let me just check, that when she came first. Yeah. So you need to put the part in about she was thinking about having a child in 12 months' time. So I would put that in. Because if you don't, just saying she came and she was exhausted, okay, but does that really, how does that connect to the rest of the story? Okay, so I would have put something about her plans and maybe mention that she's on the OCP. So just a little point there. Because if you don't, it's like, well, this is interesting, but it's not really connecting to the general story. So if you mentioned she was tired, she was thinking about having a kid, and then she came back, and then it continues into the narrative. Okay. So a month later, she presented again with previous complaint. At the time, she was non-compliant. Now, I have heard a few people saying that, you shouldn't really use this because compliant, it's an old-fashioned term, and non-adherent is better because it doesn't carry so much of a value judgment, which you're not supposed to do, either in writing or in the speaking. Okay, non-compliant, so nice again. Now was menstruating, taking OCP. I would have maybe expanded this and said, you know, what it is exactly, stop taking her contraception pill, etc. So, even though she had stopped taking OCP for the previous months, well, right, now, I want to use present perfect to talk about the period of time using for. I know that 4 months is a period, so even though she had stopped taking OCP 4 months ago, instead of saying for the previous 4 months, just like make it so we know when she stopped. Even though she stopped taking OCP, and I would always write it out 4 months ago. Let me just get rid of that. Just a minor point. Even though she had stopped taking OCP, and we know exactly when, 4 months ago. On examination, she was found exhausted. Well, you would need a verb in front of that, a helping verb, not just she was found exhausted. She was found to be exhausted is better. On examination, she was found to be, and how can you really find someone to be exhausted? I mean, she would have told you that she was exhausted. I mean, it would be difficult for you to see that she was exhausted unless she crawled into the clinic on her hands and knees and she was falling asleep whilst speaking. It would be difficult. So she was found to be exhausted and emotionally broken down. Again, are you a psychiatrist? How do you know that she was broken down emotionally? You could maybe say that she was emotional or highly emotional. Let's just have a look at the case notes. Again, so what's it say? Work stress, to reduce hours, work stress. Look it right, slightly teary. Okay, but is that emotionally broken? Maybe not. You can maybe say she was somewhat emotional, a little emotional, or somewhat emotional. Okay. She was becoming anxious. Now she's becoming anxious. Okay. Now I would conjoin. I would put these 2 sentences together, right? Because it's pertinent, you can add it. There's no need to have a separate. She was found to be exhausted, somewhat emotion, breaking, and emotional. Now, you can make a relative clause, and that will be good in terms of grammar. But so on examination, she was found to be exhausted and anxious. Okay, so I would put it like this. She was found to be exhausted, somewhat. Okay, let me just change this now. Now I think on. She was be exhausted, somewhat emotional, and anxious, which, let's make a relative clause, which crucially anxious, increasingly due increasingly. So she was found to be exhausted, emotional, and anxious. Now let's make it a relative clause, which was due to her failure to conceive. Okay, so that's good. So we can put all those things in. It's a list, yeah. So she was found to be exhausted, somewhat emotional, and anxious, which, relative clause, was due to her failure to conceive. Therefore, I don't know about using that because that means as a consequence of. Now, that's not always the case. subsequently is better because it means following afterwards. So a correlation does not necessarily equal a causation. So therefore, this was due to this. Well, you don't need that. You can just say something such as subsequently, meaning following afterwards. Subsequently, the nature of I don't know about the nature of conception. Seems a bit abstract. The frequency of intercourse, again, that's in general terms. You could put all this and the mechanism of conception. Well, no, I don't think that's a good idea. Simply talk about subsequently we discussed or we had a sex education talk. We discussed sex education or something such as this, because this is the nature of conception. Well, that sounds more like a philosophical concept. The frequency of intercourse, well, it's her frequency of intercourse. It's not the frequency of intercourse in general. And the mechanism of conception. So I would reword this. I wouldn't express it. I mean, it's grammatically sound, but it sounds, well, reads a little bit kind of strange. In addition, a pelvic examination, don't forget your articles, a pelvic examination and the pap smear test was done. Was done. Done. I don't like done. Was done. Was carried out is better. Was conducted. And passed. Were conducted. That's better instead of done. You do the housework. You do the dishes. You do your homework. I wouldn't do a pelvic examination. Something that you do, yes, but something that was done to her, conducted or carried out, is better. And a meeting with the couple was arranged. Well, meeting with the couple, so you mean that next time you told her to bring her husband. So that's what you should say. This practice smear test were conducted. And a meeting with the couple. Oh, I know what you mean, but you mean to say you asked for Mr. Yeah, you suggested she represent next week accompanied by wife. Well, she can have a wife if she wants, but I thought that she actually had a husband. Okay, so that's not very good. And a meeting with her and her husband was arranged. Okay, or suggested. Okay. Unfortunately, while reviewing Mr. and Mrs. Zinita the following week, Mrs. Zinita's condition was unchanged. I don't know if you would use remained unchanged to verbs there. Just say Mrs. condition was unchanged. Nevertheless, now don't use that, because that means even though, despite, but that's not what you, there's no contradiction, so you can't use that. So, upon examination of Mr. Zinita, questioning him, blah blah blah. So we don't need that. Don't use that. This condition changed. Upon being questioned, upon being asked, Mr. Zinita said or told he had a normal libido, no history of erectile dysfunction. Moreover, now, yeah, I was going to say here, because we've got all these discourse markers. Well, right, we've got, unfortunately, consequently, moreover, and nevertheless. You don't need one for every sentence. That is overkill. Overkill. And they don't mean what you think they mean in this context, so don't use them. That's kind of a throwaway line. Moreover, he was supportive. You don't need to really say that. I mean, the fact that he was there and he allowed you to check his sperm would, I suppose, be indicative that he was generally supportive. So if you have to include that, I would move it somewhere in the other paragraph. So consequently, as a consequence. Well, consequently, it's not as a consequence of. Again, it's cause and effect. So simply, he agreed. So he is going to check his sperm count. How is he going to do that? That turned out normal. That was normal on today's. So he is going to check out his own sperm? I don't think so. Let me see what the case notes say here. So yeah, so your plan is to check his sperm count. So sperm count is normal. So what you need to do is to restate exactly what you want them to do. So you need to put a sentence at the end with this in mind. I would like you to, what was the task again? To see, yeah, so you want that specialized. This in mind, I'd like you to see the couple, or this couple, the couple, I see the couple, and advise them accordingly. You could change that, or use a slightly different expression. Okay, so that's not too bad. Not too bad. Let's have a look. Get it on the screen. Okay. So, not too bad. In terms of grammar, it is pretty good. English, more or less, it is good. Just one or two little things, as I mentioned, that I would maybe change. I would maybe mentioned about her plan for having a child. Then that feeds into the narrative, yeah. And apart from that, put two sentences. It's always good to have at least one relative clause, and yeah, that's not so bad. So I hope you found that useful and not too long. So I'll see you later.